Well, I think we definitely have a quorum now. I think we'll go ahead and get started. Carla won't be with us today. So I'll call this meeting to order. This is an extension of the meeting that we had on Monday, and I'd like to remind everybody that we're still working under the resolution that allows us to have a public meeting without being present. That was made on May 18th. We don't have any minutes for this meeting yet, so there are no minutes to dispose of. The only announcement that I have is an announcement about how we're going to try to handle this meeting, and then we'll see if there are any public comments from any of the other people who are listening, or any of the board members who just want to make a general comment. We have one item on the agenda basically, and that is to discuss an opening date for the library system that will use the opening protocol that we discussed in detail at the last meeting, and David either has or will send that out to everybody so you can see any changes from the ones that were originally published in the meeting packet. So we'll do that, and then at the end, if there is some unfinished business about this that we can productively put off until the August meeting, we will take items for the agenda of that meeting before this meeting is closed. Other than that, we're really just going to be handling opening times for the library system. Sarah, could you see whether there's anybody who has any public comments, or whether anybody on the board wants to raise their hand and make a comment in advance?
Sure. Yep, for public comment, if you are an attendee, please raise your hand. I will notice that and then be able to unmute you so that you can say your comments.
Just for anybody who is not used to coming to these meetings for public comments, the protocol on the board is that we will listen attentively to any comments, but the board does not make any responses to those comments directly. So you will just know that we have noted your comment. It will be in the minutes, and it will certainly be paid attention to by the board in our discussions and our work in the future.
Again, if you are on a browser, you'll click next to your name to raise your hand. If you're on a phone, you'll do *6 to raise your hand. So far, no takers, Marcy.
Okay. Well, let's move on to the guts of this meeting then. Lisa.
I don't know if we mentioned this in the last meeting. I was not able to join. I got a letter from a patron who was concerned about the hours of the drive-through pickup at Northside, that it was really, really backed up. And so I just wanted to mention that and to bring that here for consideration. I'm sure she sent it to everyone, and I didn't know if we have any thoughts on that, or if perhaps our conversation today about reopenings or the next phase will address what those concerns in the letter were. I just want to make sure that that came to conversation.
Thanks, Lisa. Yes, this is something that has been an issue, and that will be dealt with as the personnel can be arranged to do that. We have a proposal to open the library, and I'd like for David to pose to us the questions that he has for the board, where he would like our discussion and support.
Sure. So on Monday, you all reviewed the library's Tier 3 guidelines for opening. We went through them at quite some length and detail. The board provided very good feedback, which led to 3 alterations in the plan, which are in the revision that I just sent out. Staff has had a chance to see those, and I have a recommendation, basically. The JMRL administration and emergency planning committee have prepared the safest possible reopening plan for Tier 3 of JMRL's response to COVID-19, which involves using limited appointments to ensure social distancing and mask wearing by both the staff and the public. This plan has taken into account much feedback from the library staff. It's been vetted by the library's legal counsel, insurance company, and the health department, and has been approved by this board. I acknowledge that this plan is asking staff to assume more risk than they currently are in a contactless environment, but there are structures in place to mitigate the spread of infection in every way possible while still providing a more full range of services. I support this plan, and I'm recommending to the board a trial period of 2 weeks beginning on August 10th. This testing the waters period would also add Monday evening hours of 3 to 7 at each location. Contactless curbside and drive-up service would still be available at each location. Once this proof of concept period is over and JMRL has demonstrated that this model can be done safely, I hope to be able to report to the board at your next meeting with plans to potentially change or expand hours and services at select locations as needed to address the issues at Northside. So my recommendation is that JMRL move to tier 3 of our COVID-19 response beginning on August 10th. And I would like the board to consider that and vote on that.
Thanks, David. Just a clarification, will curbside services be available 3 to 7 on Mondays?
Yes, every open hour for the library. So for the 2-week initial period, it will be 3 to 7 on Mondays, 10 to 2 on Tuesdays through Saturdays. And I'm envisioning that at the end of that 2-week period, we're going to need to add more service hours, especially at Northside, where right now they are by far the heaviest used resource.
Good. So what I'd like to do, just to make sure that everyone has a chance to both ask questions and then later to state their opinions and any concerns that may be able to be answered by either David or me. I've got the best I can. I've got health statistics for our region that I can hopefully speak to specific issues with if that's something that comes up. But I'd like to go one at a time and just ask people, first of all, if you have any questions for David about the plan. And I'm going to go in the order in which you're on my computer screen. So it's not going to be in any kind of an order. Please bear with me. Kathy, do you have questions for David?
I have a couple. First of all, what was the decision made about those individuals and the ability to wear gloves and to use sanitizer when they were not in the viewing range of the library workers?
So as we discussed on Monday, a couple things to kind of mitigate concerns the board had about browsing and touching of surfaces in the library. So the primary recommendation that I got from the board on Monday was to have quarantine carts available out on the stacks so that if somebody pulls an item off the shelf, it then goes on a cart to not be in circulation for 3 days. So that was the number one takeaway that got written into the plan, Kathy. Hand sanitizer will be available for the public upon entry at each location, and gloves will be available at that same, each location will have a small table where there will be masks for folks that are unmasked and hand sanitizer and gloves available. Only the masks will be required.
And then the second question I had was, what about the bathrooms?
Yes, bathrooms are available. We had much discussion about this. There's signage on them that's been vetted by the city and our attorney and the insurance company, effectively saying use at your own risk, because they cannot be entirely sanitized between each set of appointments. If you recall, the appointments are on the hour, so 5 people will come in at 10 o'clock and have up to 45 minutes, and then they leave. There's 15 minutes to clean, and then at 11 o'clock, 5 people can come in. We will do the high contact surfaces, which effectively means the doorknobs to get in and out of each location, but they won't be deep cleaned until the cleaning crews come overnight. So the signage will reflect that basically says that they're cleaned and sanitized daily, but not during the day. Okay. I didn't think, Kathy, that it was, I'm not sure where the law would fall on this, but if you're opening a public space, I'm pretty sure you have to provide some sort of bathroom service. I don't know that for a fact. Our legal counsel did say that he thought that we could remove that because of the pandemic. But to me, I mean, it's not a resource that's provided, especially in the downtown area for folks that need it.
Kathy, do you have any other question?
No.
No. Mike, do you have questions for David?
I have a brief comment at some point, but no questions at this time.
Okay, I was going to take comments after all the questions were answered because I thought some of the comments might have been already addressed after questions. Erica, do you have any questions? No.
I don't have any questions.
Lisa?
Just had a question about enforcement of the mask rule and what kind of burden this is going to place on staff to enforce it. That, you know, I feel like I really like the idea of having the appointments. I think that's great. I think that, you know, I can certainly see how having just 5 people for 45 minutes in the library at a time will reduce a lot of, you know, spread and vectors and whatever. But I am concerned about the burden that it will place on staff if people refuse to wear a mask or have it on, but they only have it on their mouth, but their nose is showing, you know, like there's just so much irritation that I just personally have seen at other people. But I don't know, I don't know, like if we have a plan for that or a protocol to deal with patrons who might be, you know, belligerent for some reason. I doubt we're going to get belligerent library patrons. Library patrons are good people who follow rules, but maybe we'll have some renegades. I don't know. Thoughts?
Yeah, and it is such a hot button issue, you know, nationally that there are definitely concerns. This was the #1 staff concern with the original Tier 3 guidelines that you all saw last month, was the mask guidelines that JMRL had in place. We were able to step those up with 2 things. 1, the governor becoming more strict on enforcement, and 2, the change to an appointment basis. So currently at this point, Lisa, the patron has to agree beforehand to wear a mask entirely covering their nose and mouth for the entirety of the time that they're in the building. So they have to make an appointment, you have to call basically and talk to somebody, and they'll have to agree to that beforehand. They'll have to agree again at the door before they can come in for their appointment. And the agreement is that they will wear it entirely covering both their mouth and nose during their visit. Should it be a matter of, you know, it's slipping below the nose or whatnot, then staff will handle that by saying, excuse me, you know, that as you agreed, we'll have to cover your mouth and nose, and I'm sure that will be it. Should it be a blatant thing where somebody comes in and rips their mask off and says, you know, I'm not going to wear this thing, then we kick in our conduct policy. Basically, this is a disruption. It's disorderly conduct in the library. So the initial staff response is to tell the person, you know, you're violating the library's conduct policy. You're going to have to wear the mask if you wish to stay in the building from 6 feet away. Staff is not to have any close contact, period. Not just when someone's unmasked, but period. That's part of the plan. From 6 feet away, yelling, we've got a megaphone at each location if need be.
Wow.
Telling them to put the mask back on, or they're not going to be able to use the rest of their appointment. If somebody refuses at that point, they're going to be asked to leave the library. And if there's a refusal after that, then it's a trespassing issue and it gets kicked up.
Okay. Thank you. That was my only question.
It's a major concern.
It is, obviously. Wendy, do you have questions for David?
No, not at this time. No, I don't have anything.
Thomas, do you have any questions?
Just 2, thank you. The first is why August 10th? Is there any significance to that?
No, I think that staff had been preparing for the board's decision on Monday with that date potentially in mind as 2 weeks in order to prep physical spaces. The physical spaces at this point are basically already prepped because JMRL had been through 2 earlier proposed move to Tier 3 dates, like a deadline saying that they would be there. So in our discussion on Monday, we talked a bit about data, and Marcy says she has some data today too. The idea is that this is the safest way we can offer service. The library staff is ready to do it. We're prepared. That gives us an additional week to get ready for the extra hours, and plus to let people know, because if it's appointment only and people aren't aware, then nobody will be there. But basically, it's the soonest point at which the library could kick these plans into gear and get all the preparations done that need to be done.
Okay, perfect. And sorry if this one was also covered on Monday, but second question was sort of looking back at the initial description of the 5-tier process that we have to work from here. 3 and 4 both seem to be heavily dependent on advice from the local health district to determine when we are moving between them. And I'm just curious if you could speak a little bit more about sort of what the cooperation with them will be for evaluation and advice, and what the metrics are that they might be looking for to stay at Tier 3 or when it's time to move back to Tier 4 if necessary.
Yeah, initially when JMRL was moving up the ladder, there were weekly calls with the health department, and it wasn't just myself talking with the health department. There were weekly calls for service providers in the area, which included the local governments and various different departments there. So we used that data very heavily before they kind of built these portals and systems there. JMRL has worked very closely with the health department as part of our mask giveaway program, where they provided, I believe, 4,000 masks to give away to the public. We've given away over 3,000 of them. So we've made contacts there individually, which has been very helpful to get information. So if I have questions, I ask them. The bounds of these guidelines that the board agreed to on Monday are well within both the state's phase 3 reopening and the state's phase 2 reopening. It's much, even in fact, I think you could make the argument phase 1. If it's
Okay.
But basically, the health department reviewed our plans. My specific area of interest that I wanted them to focus on was how to handle potential staff contact, either inside the library or outside the library, like what vectors need to be considered to ask people to quarantine or to insist that people quarantine. So that's the most communication we've had. My impression from them, they're not going to make a recommendation about any given offering, basically, like the library, unless things begin to be over 10% positivity in the region. So not just Charlottesville, but Albemarle, Green, Louisa, Nelson, and Fluvanna. At that point, I think they are going to start making recommendations, but I also would guess that at that point, the governor would have stepped in already. Does that answer your question, Thomas?
Mostly, but it seems like then maybe there aren't specific metrics in place outside of those state level phased guidelines to help us withdraw from this if there is a situation that causes employees to feel uneasy in the library, if we start getting cases among staff or things like that. And so I'm just a little bit curious about if we're comfortable moving forward with the plan that doesn't give us that sort of clear guidance on when to go backwards if we need to.
Just to jump in here a little bit.
Sure, absolutely.
Some information about that in the protocols that we approved on Monday. One of them is staffing. I mean, David was very clear that if the staffing is affected negatively to the point that we can't adequately provide services, then a branch will be shut down, for example. And I would imagine that the same will hold true for the rest of the system. If we've got 2 or 3 branches that have had to shut down because of personnel being out of the pool of work, then probably it's going to be a message to us, Thomas, that we need to pull back on the services that are being offered to protect both our staff and the public.
Well, I completely agree. I guess.
Is that fair, David? I mean, and that's something that's really hard to put in numbers because each of the branches is so different in terms of the staffing that they require.
Well,
Yeah.
fair enough.
If there's a contact situation where a staff member tests positive at any given location, it's most likely going to mean having to lose services there. The only exceptions would potentially be Central and North Side because of the size of the buildings, or if there was some unusual circumstance where that person had been alone, or we'll look at the individual situations, but most likely because of our staffing levels and the size of our buildings, a positive test case by an employee will definitely lead to those steps. Thomas, this did come up in the staff feedback form as well that staff asked questions about. And the response there from the Emergency Planning Committee was that we're looking at basically the percent positivity in the region. We're relying on the state's movement up and down the Forward Virginia plan. We're looking at the offerings of our local county jurisdiction. So the City of Charlottesville City Hall, Albemarle County Office Building, those things. So it's some combination of those 3 vectors that we're going to be watching every day to see whether or not there's a need to step back if we do go forward with tier 3 of JMRL's response.
Okay, thank you very much. That's all I have.
You're welcome.
I just have one sort of question. How are you going to monitor the use of services so that we can anticipate maybe the next stage of what we need to provide based on what is actually being used by patrons in this registration system?
We'll track the same types of statistics that we normally do for computer use. That one's fairly easy. You know, we'll be able to see how many folks are using the actual in-building computers and internet access during our times. Checkouts as well to kind of, we'll have to keep an eye on what's going out through curbside versus what's going out in the building. And then those are the two main services. That the difference between kind of checkout in building and outside is the discoverability of being able to use the entire library, you know, being able to browse and find things that we can't offer right now. The other thing that we can do is track reference questions as they come in to see what areas people are needing assistance in. Annually, we do this twice in April and October in order to report data to the state. But that's something that we could start doing during tier 3 if need be, so that we know at the end of that 2-week trial period, okay, well, it turns out nobody wants to come in and browse. Everybody wants to come in and do X, Y, or Z. We can adjust our services based on that data.
The other things that I can imagine that people might be coming in to use are scanning and copying service.
Yes. Excellent point. Yeah.
And they also may be requesting things that we're not able to provide, like notary service, which is something that's generally offered at our branches, and especially in, you know, Nelson and some of the outlying branches, it's a really critical part of the community service. So will the staff have the time and attention to be able to keep notes on these so that we can keep track of what people are asking for most as we move into deciding whether to stay open or whether to increase services?
I think that's something that the emergency planning committee can come up with, some sort of checklist or form for staff. They've already got a million of them, but one more won't hurt, right? where they can say, you know, how many times I've been asked for this, because I can tell you anecdotally the things that we're being asked for. Number one is donations. People want to donate books, and that's a Friends of the Library decision, but they'll look at what the library is doing to help make that decision. Number two is notary, fax service, those types of things that they can't get in other places. JMRL, the Emergency Planning Committee talked in great length about notarizations because it is a valuable service that it's over the years has become much harder to find in other places. It used to be you could walk into your bank and get something notarized, but nowadays they only want to notarize bank business. Or that you could go to the courthouse and do that, but then that's less of an option depending on where you are. So I think we will try to figure out a way to offer that service, but it's very difficult to do without close contact. That's a challenge, but keeping track of how many people are asking for will kind of push whether or not, you know, to what degrees we're willing to go in order to provide that.
Well, that's what I was hoping, that we would be keeping good enough track of what people are asking for that we can't provide yet.
Well, and then also, I got a suggestion from Mike, and Krista's echoing it right now, that we keep track of the services that we have to say no to. So the appointments that we have to turn people away from, if the sixth person wants to make an appointment.
Absolutely.
To help decide about hours. And I know at Northside, even if the board today were to say, we're not gonna, you know, we disagree, we're not gonna move forward with this, we're gonna need to expand the drive-up hours around this same time frame. As far as I'm concerned, that's something that staff can do without needing board support, because it's just an expansion of what we're currently offering, and it's not going over the schedule that we would offer pre-COVID. But yeah, that's kind of data about how many people we're hearing from and how long the line is. I checked today, service ends at 2 o'clock, and at 2:15 there was still a line of cars there, and staff was meeting all the need there, but it was taking longer than we would like.
Yeah.
Okay. So we'll move into the comment section. And I'll go through everybody one at a time again. We do need to make a decision to support the staff and what they're going to be trying to do. So make your comments pertinent to how well you feel, how comfortable you feel with the plans that are in place, with the idea that we would be opening for these new services on the 10th of August. Kathy? Kathy?
I support Tier 3. However, I do not support it being implemented on August the 10th. I realize a lot of thought has been given, and I realize the staff has worked diligently to get this together, but I still feel that we should not put them at risk Because if I'm correct on this, and Lisa may be able to be the one to tell me, isn't that about the time the university starts up?
Yeah,
And
we're
it's-
starting on the 20, we start on the classes, my first class is the 25th, I believe. And
But the students come
will be
into
coming
town.
in, yes.
Okay,
I think they're
And
coming in phases.
okay. And my biggest concern is at this point in time, being a part of the population that is most at risk, the influx of the students coming in from outside of the community, which we welcome and we know that that's a pillar of the community. I am still fearful that we will see an uptick. And out of all of this, I don't want to see the library have to close because of someone contacting the virus. I just, tier 3 is perfect. I have no qualms with it, but I don't think August the 10th it should occur.
Michael?
I would like to just first kind of express my appreciation for really the extraordinary care that the Emergency Planning Committee put into this tier 3. It's very thoughtful and detailed, and I'm impressed even that it's not only what they think makes sense, but it interfaces with things like the national. I'm just looking at the FFCRA leave and state phases and local phases. So it's not just created in a vacuum. It's carefully sort of balancing these broader agencies or entities that also have thought a lot about the current situation. And I do note that and this is a point that I think Carla Mullen was trying to make on Monday, that the tier 3 is well within, as David said, the current state and even local guidelines, certainly for businesses. And in some ways, this is sort of the smallest step that we could possibly take in terms of, incrementally opening back up, with 5 people in the building at a time. So in some of our facilities, they're smaller facilities, so that actually will kind of fill up the space in a sort of a 6-foot mode. But in other facilities or very large facilities, if you think of Crozet Library, that's just I think a very small incremental step to take. So, and I think at some point we have to take the step. Once we do take this small step, we're going to learn from it, and I think that's the key. The key benefit is, hey, let's do this as David has kind of framed it. Let's take this smallest possible step, learn from it. In 2 weeks, that's when our next meeting is scheduled for. David will report back and we'll adjust as necessary. So I guess I would ask, if not now, then when? But it seems to me that the scope of this step is prudent, can be justified as prudent, based on the really small increment that we're taking here. Thanks.
Thanks, Mike. Erica? Erica, do you have a comment? Sorry.
Yeah,
So I
can you hear me?
respond.
I agree with Mike that this is well planned and very prudent should we move forward. However, looking at the model forecasts that are coming out, especially of UVA, they expect a spike and they expect it very soon, probably within the next few weeks, right when we would be inviting people in, which causes me some hesitation. Also, I think should we fall into some sort of we're open, no, we're closed because people got sick, oh, we're open again cycle, is going to be fairly confusing for the general public and hard to get that messaging out in a useful way, both to let them know that we're closed when they want our services and to let them know we're open when they think we're closed. And I don't know that there's a solution where we avoid that in the near future, but that's something that has crossed my mind as maybe not being the most useful. So those are my reservations.
Thanks, Erica. Lisa?
I'm very torn. I am very grateful for all the work that the that the library staff and the committee has put together to create this report. I really want to just echo that. And it seems to me like, yes, you know, they would not choose to endanger themselves, right? And David would not choose to endanger the library patrons and, you know, and workers. I also can't help but think that, you know, Charlottesville City Schools aren't opening. They're doing online only for the first 9 weeks. UVA is doing a small amount of classes in person, but might end up switching those to either a hybrid or in person or just not at all. So I guess I'm trying to think about, and maybe David, you can help me with this. What is who is most harmed by us keeping things as they are now and not moving forward to tier 3? What are we not providing? Because it seems to me that if, for example, schools are closed and it's online only, that's a big rush of people, students, young people, kids who will want to be in the library. And that's, you know what I'm saying? And so I'm just trying to figure out how to balance that. And I don't want a grand opening, grand closing kind of situation that Erica describes. And so much of this is speculation because we just don't know. Mm-hmm. But it does make me think that if we're bringing back students from across the country back to Charlottesville, which we are, I think that's going to lead to something, even though I think they have to report their health every day in an app. They have to, I don't know if we're taking temperatures at the door for our in-person classes. No one told me that, but you know what I mean? Like, I don't know. What do you think? I don't know. Maybe it's not my turn. Maybe it's David's turn he'll have to answer at the end, but that's my concern.
Well, I'll just address, so the question is who is not getting service right now? And the primary driver is the folks that have no broadband access or no hardware to use computers. And the digital divide that we've been talking about in libraries for 20 years, yeah. There was kind of this assumption with the rise of cell phones and smartphones and whatnot that was gone. And what we're seeing right now since March is that it's worse than ever, that the folks that don't have access are left out of they're left out of the educational process. They're not to say the local schools are going to go above and beyond to try and solve those things.
But for people who aren't in school, right? For adults who don't have internet access at home and who can't use the computer.
Yes. So for job searching functionalities, for the folks looking to fill out unemployment forms, for the folks who just need this as a means of communication to stay in touch with the world, definitely the internet and computer access is a large driver of allowing people into the buildings in order to do this. Otherwise, I think that what you're talking about with the schools not being online, yes, there will be, I think, some demand on JMRL resources as every parent tries to become a homeschool teacher. Yeah. Need resources. So I think that the appointment service that we can provide is the safest and best way to help connect those people with resources that they wouldn't necessarily be able to get just from viewing the online catalog. I think there's some discoverability for being in the library and seeing, here's this and that leads to these things that we can't offer right now. Our online catalog is pretty good actually about that discoverability, but it's not the same at this point. So to me, those are the biggest concerns, that the things that we can't offer right now. I agree with Erica's point that we don't want to be opening, closing or whatnot, but it's not my vision that we would ever go back to tier 5, which was closed entirely, as long as there's not a catastrophic situation in our area. I believe that JMRL could always fall back, even if it's a branch at a time or altogether, to tier 4 offering curbside service. So the only way I see not offering any service is if there was something catastrophic in the area.
And just a quick follow-up, David, do you feel that the appointment only options and limited hours and 45-minute max on a computer, is that sufficient time to meet the needs of those people who don't have broadband at home and who need internet access for job searching, communication with family? Like, is tier 3 enough?
Yeah, that's the question, right?
It's like, if schools are out and kids are, learning at home and need resources, I'm just saying it feels like that's a lot of pressure.
Yeah. So
on a limited time span.
That's one thing that I think works with this model is that it gives us 2 weeks to work out the kinks of, making staff comfortable with the idea, letting the public know about it, working out the kinks of the appointment system, seeing all those things. And then we meet again to talk about an expansion, because I've already had requests from staff at certain branches who say, look, that unemployment form takes more than 45 minutes to fill out. This is to meet the needs of that patron. So we'll do what we can in that period, but then this is also a period to evaluate, like, this is safe, we can do this. Let's look at maybe opening up, computer sessions 1 or 2 at a time for more time, or we're working on a program to get some Chromebooks that are available for people to check out and use on the exterior of the building as well. So we could check them out at curbside, even if we were to fall back to tier 4 and folks could be within the Wi-Fi range of the, of the building. But yeah, that's an excellent question. And I think first we need to prove safety, and then we need to look at more service if we can do it.
Because this, I think, will be my last thing for now, but I love the appointment idea because I love the way that it thinks about safety, right? 5 people is manageable. But it also seems to me that in our very, very popular branches like Northside, that I don't know if that is even going to stem the tide of all the number of people who want to get into the library. And does this make it feel a bit less public because of the steps you need to take to get in the building? And you know what I'm saying? I don't know.
No, I absolutely hear you. And that's a real concern. I think expanding the hours, what I have heard from my colleagues around the state, directors at other library systems, is that they are not seeing the mad rush of people trying to get.
Okay.
That none of them, most of them are operating still under the phase 2, 50%, their rules saying no more than 50% occupancy. And that's based on like the fire code limits and things like that. It was our original plan until staff feedback said, hey, let's try something different. But they're finding that people still, the majority of people who are looking for materials want that contactless service.
Yes.
So I think no matter what, especially at Northside, that needs to be expanded on the 10th, one way or the other. Whether or not the 2-week trial period is going to meet those needs will remains to be seen for when we do that. But I think it will. What I've been telling staff all along is that they've worked so hard to make service the top priority of what they do. And now they have to take a step back and make safety the top priority and service the secondary priority.
Yes.
Which is difficult for folks that have dedicated their careers to providing service. But I think at least for that 2-week period, it's like, okay, let's make sure that this plan is as good as we think it is. And then we can look at what are the real needs and how can we expand it.
Okay. Thank you.
Thank you.
Thanks, Lisa. Wendy, comments?
I think everybody has expressed my reservations and also the benefits and drawbacks of the plan. Once again, well thought out, well executed plan put forward. And it's just, it's just a difficult decision. I go back and forth, and I'm pleased. For me, 5 people is very minimal, but then I'm struck by the amount of time and energy and staffing it takes just to address those 5 people. But and then I'm just very much on Kathy's side because I am in the age category of being more at risk. So you can't make an easy decision. You couldn't have done any better coming up with a plan that protects everybody in the library and the patrons. So I'm leaning, but that could change in 2 minutes. I'm leaning to the kind of limited opening and seeing how things go. But I'm not in Charlottesville. I'm watching the Charlottesville news. The school, the schools went virtual. Fluvanna just went all virtual. Or no, they just moved their opening date. And I'm just more tuned to schools. I'm just using that as a reference. Thank you for sending all the other information, David. But Fluvanna just extended their opening to after Labor Day. So there's, and nobody, when they're doing these things, well, I don't follow Charlottesville that closely, but I'm trying to. illuminates exactly what, what caused that. Was it they weren't prepared with a tier 3 like we have? Is there information coming out about the virus and the spread that we don't know? Yes, we have numbers, but in the counties here, there's no public information, so we don't know if there's a cluster here or it's just very intimidating and makes it, nobody wants to make the wrong decision. But hopefully this is a start, and I'm leaning toward the reopening just because I've seen how competent the librarians are, but only if the majority of the staff is in agreement as well. I mean, the emergency committee came up with this wonderful plan, but I don't know. I'm never very good at decisions that are so dire. So maybe you everybody's addressed all the questions and information and reservations I had. I don't know if it made me move any further in one direction.
Thanks, Wendy. Thomas?
Well, similarly, I think at this point, a lot of my concerns have been voiced, and a lot of the benefits of the plan have been advocated for as well. Yeah, I am particularly swayed by the confluence of reopenings going on around the same time, and that does leave me wondering if there wouldn't be a benefit to delaying this by 2 weeks or a month and seeing how some of the other things in our area shake out. But regardless of if we do this on the 10th or later, I think, David, your point is very well made that something has to be done to improve service. I mean, Lisa, as you brought up at the beginning of the meeting, we got the email, and I know that the experience I see out my window here in Scottsville is very different from what's going on at the larger branches. I wonder if there isn't an opportunity with the COVID relief funds that Albemarle County is now trying to disperse, which are not supposed to be replacing lost revenue, but supposed to be directly addressing needs created by the crisis here. If there wouldn't be an opportunity to reach out to them to try to access some of those funds to improve things that we can send people home with to help. I don't know if the county could buy us hotspots that we could put in collection and let people check out or something like that. In lieu of making appointments to come in, if there's a concern about the 45-minute window length or things like that. But regardless, yeah, we would need to do something. And that's about all I have.
Thanks, Thomas. Carla sent her comments so that they could be read into the minutes. And I apologize, I am going to read them into the minutes. First, I want to reiterate my support for the appointment services plan David presented and the board approved with changes on Monday. It is my understanding that this plan responds to requests from local residents and our funding localities that libraries be open for in-person visits in some capacity as soon as possible. The plan also includes significant input from JMRL staff and considers current library capacity, both in terms of the staff and supplies needed. And the plan remains valid whether our funding localities or the Commonwealth are enforcing phase 3 or phase 2 of the COVID-19 prevention guidelines. I believe we should move forward with by appointment in-person visits starting Monday, August 10th and running for 2 weeks. At our August 24th board meeting, David should be prepared to report on the 2-week test and provide suggestions so that the board can decide whether in-person visits can continue as is, be expanded, or if necessary, be postponed to a later date. I recognize that many trustees have concerns about opening library facilities for physical use. I do too. We are in a pandemic and there's always a risk. But I honestly believe the appointment services plan with changes the board suggested on Monday thoughtfully plans for the safety of library patients and employees. There are a few more comments, but those are the ones that are most relevant to the discussion we have about the opening time. And I will just make a couple of comments. I'm looking at the statistics of what's going on right now in our communities. Although the number of positive tests has about doubled in its rate recently, the number of hospitalizations has not. And that's across the board. And I think that that reflects to some degree the fact that the testing has been somewhat expanded in terms of the population that's being tested. So the number of tests is increasing because the number of people who get access to them is increasing. I think the number of hospitalizations we have is also reflecting the fact that the medical community understands a bit more about the stages of this disease and how to treat it to hopefully prevent hospitalization requirement. The number of deaths is really very small. We've had 4 deaths in our region in the last week, but we had not had a significant increase in the deaths up until this point, if you're looking at this as a rate of dying across the time span of the virus. We are, however, as several of you pointed out, looking at a period when things are going to be changing pretty dramatically, especially in Charlottesville, with the students coming back into town. And I think, my opinion is that if we're going to try this, we need to try it now before the students are really back so that we can see whether our plan is actually feasible and we can see how we're operating as the number of infections continues to increase a little bit, but is not hopefully reaching the kinds of proportions that we're seeing in some parts of our country that are being so badly affected. We do have the opportunity to review this before the schools really need to get off the ground, the students really need to start. And I'm talking about our K through 12 students, really need to get back into a learning mode, which I hope the library is going to be able to support by expanding the services that we have, whether it's just expanding curbside hours or increasing the amount of service we have actually in our facilities. But I think that the really critical thing here is that we do a good job of keeping records of how the test is going. We see how staff is responding. We see whether in fact we're having any problems with infections related to any of our branches before we get into the fall. We're going to have a couple of years of this, so we're going to have to figure out how to live with it and how we can keep moving forward, all of us, but especially the younger people in our communities. So I hope that the library can contribute to our learning how to deal with this. And I think that opening on the 10th is probably, in my opinion, one of the ways that we can at least start testing the water and seeing what we can do. Does anybody else have any comments in response to anyone else's comments? Lisa.
I just have one, and this is just a personal feeling. I feel uneasy. I trust the staff, I trust David, and so it feels good to say, yes, let's vote for this plan that they have come up with. The staff doesn't want to jeopardize themselves, but when the next board meeting rolls around, I do not want to do it in person. And so it feels to me problematic for me to say, yes, you library branches open, do your social distancing, do the appointments, do all the things to keep safety, but I am not coming in a building. I'm not doing it. And so I'm just trying to understand what that means for my vote. Does that, you know what I mean? I don't want to be
struggling with the same thing.
Like the Supreme Court, right? The Supreme Court says, no, Michigan, you can't mail in your ballots. No, Wisconsin, you can't mail in your ballots. And they only vote by mail. Supreme Court judges vote by mail, but nobody else can. And so I don't want to be in that position, but I honestly don't feel comfortable rolling up to a library right now. So if other people do and want to take the risk, why should I prevent them? But I'm just saying where it's landing with me right now.
I'm in the same boat. Yeah, I agree.
You know, there are things that it's very difficult for us to do as a library board with distance meetings. And one of them is one of our primary responsibilities, which we have been putting off since May. And that is giving David feedback about his performance over the last year. And I think we're really falling down on the job if we say, I can't meet with you, even if you clean the room, even if we sit 6 feet apart. I can't meet with you to discuss a critical part of our board responsibility. I think that's really abdicating responsibility here. I realize there's a risk, believe me. I worked in medical environments where there was risk all the time. Not like this, but clearly there. And I understand what we can do to mitigate it and to stay healthy in the context of that risk. And I also realize that there are people in the community who are so prevented from doing the things they need to do, like finding housing, like finding jobs, like getting books for their kids to start reading at home when they're 4 years old and they need to start getting ready for school. That it's really hard to do other ways. We don't have those resources in the community outside of the library. So that's my response, Lisa, to you and to Wendy and to Kathy. I am totally appreciative of the fear here. And people have different responsibilities outside of our board responsibilities in the library. And I understand that too. But I think we need to think a little bit about our communities and what we can do to make sure that the community gets through this as well as it can.
Well, I have to say this. I understand everything that everyone has said, but I really resent the fact that we point out we have to be in and we have to do David's evaluation. David is a wonderful person and is doing an excellent job, and he needs an evaluation, I agree. But I am not going to put myself and my 90-year-old mother at risk coming in, and if it means that I resign so somebody else can carry on the banner, I have no problem writing my resignation. But I, at this time, do not feel safe coming in to meet with you all. And David, I respect you, and I will do anything I can on this computer. I have worked very hard to master these skills, which you know I came on the board without a lot of this. But if it's going to be a community and we're going to be putting it against, well, you can't come and hold my hand or sit beside me and you're not holding up your responsibility, then let the record show my resignation is on its way. But at this point, I support Tier 3. I support it, and I really am proud of the staff. But at this point, I don't approve of August the 10th. And no, I'm not going to be a hypocrite and tell them to go back to work, and I'm not coming in to see y'all. So that's just the way I feel. And I don't mean to use the language too strong, but if you feel that me not being in attendance, let me know now, because my pen is ready to move. Thank you.
Wendy, do you have a comment?
I'm just trying to process here.
Okay. Well, I think we're at a bit of an impasse here in terms of the comments. I would certainly be willing to take a vote if someone had a motion.
I think the only way to kind of resolve, I've heard all the back and forth, and I'm not going to respond further to any of the comments. But the point is, the only way to resolve is to call the motion, take a vote, and it'll land where it lands. And then if we need to revisit, well, we will revisit one way or the other 2 weeks from now, sure. So I would move the original motion sort of as phrased originally by David. which was, and David, correct me if I'm not going to phrase everything correctly, that the JMRL moves forward with the revised Tier 3 guidelines starting on August 10th for a 2-week period, and then to be reconsidered at the Board of Trustees August 24th meeting.
I'll call for you once at a time for votes. Kathy?
No.
Erica?
No.
Lisa?
No.
Mike?
Yes.
Wendy?
Ay, 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 ay. I'm going to say no.
Thomas?
No.
I would say yes, but clearly the board is not ready to support reopening at that level.
Okay, well then, what staff will do is come up with some revised curbside hours to go into effect on the 10th. I don't believe that there's any more revision that needs to be done to the plan as is. I think the board can revisit timing on the 24th. I might have to reach out to some of you individually to speak to your jurisdictions about the decision-making here and to explain kind of the things that got talked about. To let them know, that the libraries aren't going to be opening for in-building service on that timeline. We've already pushed a few times, so I think most of them will be open to that conversation. But Marcy, if that's agreeable for you, then that's what we'll do is we'll look to expand curbside on the 10th and then come back and the board can discuss the situation on the 24th.
I think that sounds like what the board is asking for, David. We never talked about future agenda items for next month's meeting. I know that Mike would like to try to hold a policy committee meeting to get that year's work started before the board meeting. But David has some agenda items that he'll list, and then if any of the other board members have agenda items that they would like to put onto the calendar, I'd like for you to note it now.
Just one that we didn't get to on Monday was to have a vote on the revised schedule proposals for fiscal year 21, including a Juneteenth holiday. So that will need to be addressed on your meeting on the 24th. And then, well, there's the director evaluation, but Kathy just told me I'm doing great, so I think we're good there. It sounds like that might be pushed. We can certainly discuss. There are ways to try to do that remotely. Marcy and I can talk about that, whether or not that's an option for now. You can kind of set up a sub meeting within the Zoom meeting. But anyway,
I would just like to mention, I would have no problem with whether it's next month or a future month, a hybrid type of meeting where there is a physical option and then certain our bylaws already allow for remote participation. So in general, I would have no problem with a hybrid part physical and part remote meeting of trustees, and in particular on this topic. At some point, I think it's going to be more valuable to hold the hybrid meeting sooner than just wait indefinitely for a time when everyone is comfortable being together. So that's an opinion that I have there.
And I will tell you that
That's a good idea.
I feel very uncomfortable trying to hold a completely virtual meeting of that sort. Not least of which my concern about privacy of that meeting is pretty high, given what's happened with the Zoom meetings in the past. But
Marcy, I agree with you, and Michael, I agree with you also. Can we wait until the 1st of September to make a decision? And then we have the month of September to see. And then after that, maybe decide how we will, some people will be virtual and some people will be, which I'm praying and hoping that September will bring a better day.
bless you, Kathy.
Yeah. I mean, for us to come together.
Is it
as a
possible
group.
for us to discuss that at the August 24th
Yeah.
meeting?
That's what I'm trying to say.
Good, thanks. Are there any other agenda items that people would like to see? for the August meeting. Good. Well, I think we've accomplished our purposes for this afternoon. I really appreciate your coming and I appreciate all the thoughtful comments. I know how hard this is for everyone. I know how hard it's been for the staff. And I hope that the staff who may be listening and David will communicate to those who aren't how much the board appreciates what the staff has done and continues to do and the difficulty of the situation that they're facing. Do I have a motion to adjourn the meeting?
Could I, if I could just make one brief announcement before we adjourn?
Oh, of course.
I just wanted to update you all. Last year, the board wrote a letter to VDOT in support of a sidewalk application here in Scottsville that would have helped connect the Scottsville branch to the larger sidewalk network in town. The town was awarded that grant last week, but now needs to decide on whether or not they want to provide an $80,000 match to the VDOT money. And given the current circumstances, that is a tougher decision than was originally anticipated. So if the board feels it appropriate to write a letter of encouragement, I would be happy to deliver it with gusto.
We will do that, Thomas. Thank you.
Thank you very much.
Can I say one thing, Marcy?
Sure.
I did get feedback from staff that really, those that listened on Monday really appreciated the time and care that the board put into discussing the library's Tier 3 guidelines, and especially the concern that the board had for safety of staff members, which is of the paramount for library administration and the planning committee. But they definitely appreciated that discussion and hearing how thoughtful the board was about making sure that the staff was safe. So I just wanted to pass on those congratulations from, those thanks from JMRL staff to the library board.
Thank you. Is there any objection to adjourning this meeting?
Can I very quickly ask, how technically, this is a technical question, is everybody's Zoom working now, David?
Right at the second, can I see everybody on Zoom?
No, yeah, I mean, is the timing, I mean, you said before mine was
Oh,
not,
the lag.
yes.
Yeah, everybody's coming in pretty smoothly as these things go.
Okay, so this is better than it was previously,
Absolutely.
particularly.
Yeah.
Okay.
And kind of, Marcy and I will talk about the format for the next board meeting, but I will also offer to those of you who need broadband access, we can make library space available for you to have obviously we won't be open because of this decision, but a space in the library where you can be alone to use a computer and broadband access if you need it.
Which is the only way that I can do Zoom.
Well, and it's kind of interesting being in a car.
I'll bet it is, Wendy.
Careful, Wendy.
That's really above and beyond, I'll tell you.
In transit.
Again, are there any objections to adjourning this meeting? Thank you very much. The
Thank
meeting
you.
is adjourned.
Have a
Thank
good
you, everyone.
weekend, everybody.
Thank you, everybody. Thank you.
Stay safe.
Take care.